What we're looking for is selective mobility of the pelvis. When we talk about linear acceleration, which is something that we did with our patient this morning, what we want to do is raise the center of mass so that she actually gets taller so that she can stabilize her upper trunk and that her upper trunk can remain stable and she can move her pelvis relative to a stable thorax. So linear acceleration and selective posterior pelvic tilt is all about selective movement of the pelvis with a stable thorax and stable femurs. We need this movement for all of our postural transitions. The first part of going from a sit to a stand requires movement towards anterior pelvic tilt to create a linear acceleration to de-weight the pelvis, stabilize the thorax so that we can access the pelvis selectively to then move into standing. If you are still in a posterior pelvic tilt, you cannot efficiently create the motor activity to go into a standing posture. Without moving your pelvis, try to stand up from there, Cassie. All right? Which is what happens to a lot of our patients. And then what they do, they jam their knees back and then they put themselves up on top. For efficient postural transitions, we need to have the ability to move our pelvis selectively.